So I'm pleased today to introduce Kathryn Schaber, who's a postdoctoral fellow at the Computational Health Informatics program at Boston Children's Hospital and Harvard Medical School. She brings a background in mathematics and ecology to the project, and she's working on a sub-project she's going to tell us a little bit about today under the umbrella of health resource allocations under our public health thrust. So it's really interesting simulation. I'm really excited to learn more about it. And it's a nice intersection, I think, of public health, decision-making, and public policy. So really interested to learn more. And Kathryn, go ahead and take it away.
Thank you. I appreciate the introduction. So my talk is going to focus on an outbreak simulation game that I've been in development of that's looking at intervention policy decision-making and trying to educate the lay public as well as policymakers on some of these intervention decisions. So kind of motivation behind the project, the main thing is that research of previous epidemics has really found two main factors associated with compliance to public health policy is the beliefs and knowledge about the efficacy of control measures that a person has, and then also a person's trust in the government. And both of those things can be a little tricky because public health policies being put into place during a pandemic, as well as their possible outcomes, are influenced by a lot of different factors. They're influenced by things like the resources and the budget that's available, the current disease burden, and also the public awareness and their intervention uptake levels. So it's really important to talk to the public and get them educated about some of these scientific and socio-political processes that are underlying the intervention recommendations being made by policymakers, not only to increase their knowledge about the efficacy of the control measures, but also to increase kind of their trust in those decisions being made by the policymakers in order to increase the uptake and increase the effect that they can have. And then on the flip side, it's also important to really help with educating the policymakers on some of the effects that their choices can have on disease prevalence, because a lot of times these policymakers aren't necessarily going to be people that have the background in disease modeling or pandemic preparedness. So really trying to help them understand some of the effects their policy-making decisions can have. So kind of a background of where this came from. This was started in a phase 1 PIP project. So PIP is an NSF initiative for predictive intelligence for pandemic prevention. Essentially, the aim is to tackle the challenges in infectious disease pandemics through prediction and prevention. And specifically, the project that I was on was the pilot project, which is predictive intelligence for limiting outbreak threats, which had an aim to develop a pandemic modeling framework and preparedness program that really tries to address some of the major gaps in pandemic surveillance, prediction, and mitigation. And then just as a note, the simulation game first entered development during that PIP phase 1 project. That ended, so it's actually currently being supported by AI-SDM. But we're hoping to expand the game even further if we receive funding for the PIP Phase 2 award, which is what this kind of schematic is just looking a little bit at all of the different things that the pilot project is hoping to do if we get the next phase, all the different prongs. And from that, the game is really kind of trying to pull all of these things together and work as an outreach and education once we have this modeling framework and know these gaps in understanding. So originally we had actually planned a community-wide crisis simulation scenario, but as we were working through building the narrative, it seemed like an interactive online game would be a more optimal approach because it allows for a lot more people to participate. And it also allows for them to participate asynchronously, so we don't have to worry about trying to get everybody together at one specific time slot. And also, we thought it would be really interesting to do this online game where we would be able to do data collection from this diverse pool of game players regarding the policy choices that they made and really be able to analyze some things like the most common policy choices that people think will have an effect on the pandemic, whether certain demographic subgroups have significantly different choices, or if there are certain health beliefs underlying certain policy choices. So whether people have thoughts on the greater good versus personal benefit, and if that really affects the way that they make these policy decisions and things like that. So in terms of the plan of action, the first thing was really creating a branching narrative where we can get players to decide on enacting these variety of pandemic preventing and mitigating policies. The second thing was figuring out how to graphically illustrate to the players the effect of those policy choices using a disease model that was based on real world data and created, and then really try and show some of the comparative effects of the choices they made versus no policy choices being enacted, or the best possible set of policy choices. And then the last thing is really allowing for the players to choose to submit their in-game choices and complete that survey on their socio-demographic features and their health beliefs, so that we can do some of that data analysis that I just mentioned. So for the branching narrative, we decided on these 9 policy choices of interest that are ones that tend to come up during disease outbreak, and ones that I think we've all kind of heard about, especially in the past few years with COVID. So first one being international travel bans. The second one being awareness campaigns, things like PSAs. Third, contact tracing, looking at lockdowns or school and business closures, mandatory testing, the distribution of rapid tests to people's doorsteps, mask mandates, paid sick leave, and then vaccine mandates is the last one. And within that, we needed to build this outbreak model to be able to encompass all of these changes over time and these policies being made. And the way that we did that was I started with the very kind of classic SIR model that you see in epidemiology. This is a slightly more intense version, an SEIRD model. And essentially, to orient you to what you're looking at here, each of these squares is going to be a compartment with a group of people in it. So here's kind of the key down here. This is going to be susceptible individuals. Susceptible individuals at this transmission rate are then going to enter the exposed class. And then over the time period that's equivalent to their incubation duration, they will transition into the infectious block. In the infectious block, they can then either go into the being in the dead compartment with a fatality rate and infectiousness duration being encompassed in that, or over the course of their infectiousness, if they eventually recovered, then at 1 - F rate, or the inverse of the fatality rate, they'll just go into this recovered compartment. And you can see these are the differential equations that are essentially saying that. So for example, the differential equation for the susceptible compartment, you're essentially removing people, so minus at a rate that they become exposed, which is essentially saying susceptible people times I/N, so the chance that they come into contact with an infected person over all of the possible people, and then multiply that by the probability of transmission, or that transmission rate. And as they leave the susceptible compartment, they then enter the exposed compartment, leave that one over the incubation rate, and so on and so forth, as I just explained kind of through the schematic. So this is a good starting point, but in order to account for all of those policy changes over time, the first thing that I ended up doing was adding a time varying case importation rate. And that's really to be able to encompass that travel ban. So the big thing with travel ban is kind of trying to stop people coming in that might be infectious and start spreading the disease in your country. So in order to account for that, we now have this iota at T, this case importation rate over time, where now susceptible individuals can become exposed by the transmission rate from those within their country, or by coming into contact with those from outside of their country as well. And that rate can change over time, kind of depending on things like that travel ban factor. So the next thing The majority of the next control measures are going to be included in this UT control rate. So for example, the contact rate, the lockdown, things like that. And really all that's doing is reducing the transmission rate that you would have. So for example, if contact tracing reduces transmission by about 5%, then your U is going to be 0.05. You then have about 95% of the normal transmission, 1 minus U at T. So that's what we're doing here. And you can see then that just goes in front of all of the transmission terms in the set of equations. And then the last thing, which is the slightly more intense looking, confusing one, is I also accounted for an imperfect vaccine. And essentially the way you account for a vaccine a lot of the time in these models is you build in this V compartment of vaccinated individuals, and people are going to enter this compartment based on the ADA or the vaccination rate at time T. And then because vaccines aren't necessarily 100% efficacious, we're also going to allow there to be a small amount of people that are going to go from vaccinated into the exposed category who eventually will become infectious. And that's just going to be occurring with the added term right here, 1 minus epsilon, where epsilon is the breakthrough case rate, which in this case, I said it was a 90% efficacious vaccine. So it ended up being about a 10% breakthrough case rate. And you can see then all of these terms are kind of added into the differential equations as well, which you don't need to get too into the weeds with the equations. I just wanted to throw them up there, but here's kind of the model that we're going to be basing the output graphs on. Okay, so now just as an example of kind of what that looks like in the code, I coded this in R, so this is going to be what I'm going to show some of the code in. And essentially, in order to set up this model, I just made it a function called SIR model. It takes in all of these different parameters, and then the base set of equations are going to be a function where you have, in this case, iota, which changes over time. So iota at time 0 or less than 38 will just be the base level of importation of cases. In between these two time points, once you start doing the travel ban, it will change and then eventually ends up at a certain value. Similar thing with the control, where it starts out with no control. Once you put things like contact tracing into effect, then that's accounted for in the U values. And then similar thing with the new value as well, or ADA, excuse me. And then here's just the equations that we saw before. So this function then we can use later for any kind of given set of these variable inputs and run an ODE solver to get outputs based on these parameter values and equations. So coming back to this branching narrative with these policy choices of interest, the next thing we really needed to do was for each possible policy choice, determine the relative budgetary cost, because that's something we wanted to account for, and then also the impact on disease spread. So essentially getting the time varying values for the iota, the U, and the eta values for each of these, which just as an idea, it seems like the list of 9 isn't too bad, isn't too intense, but when we actually break it out into all the different choices within that, it becomes a little bit more exciting in terms of all of the different possible choices, but also a little overwhelming in terms of the total possible narrative paths that people can go down. So when you multiply it all out, we end up with about almost 44,000 different narrative policy paths that people can take when they're going through this game that we need outputs for. And then just kind of looking at what some of these different things are. For example, with the international travel ban, we not only ask people if they want to ban all travel, but also only travel to country X, which is going to be kind of the country that this outbreak is starting in. For the awareness campaign, they can do a PSA that's either alerting the public to the disease or downplaying the disease. And this one actually will continue to affect the uptake likelihood for the rest of the game. So for the next few choices where there's a possibility of people having lower compliance, it will be affected by whether or not you choose to do an alerting or a downplaying PSA or no PSA at all. With contact tracing, we asked if they'd like to do manual or app-based. For the lockdown, we asked about reopening or staying closed after the lockdown is up. You can also close schools and or businesses, so that adds quite a different set of choices in. There's different ways you can do mandatory testing, different groups of people you can distribute tests to on their doorstep, either all or just low income residents. For the masking mandates, we asked about different types of masking mandates as well as distribution of masks to people on their homes. And then finally, for vaccines, we not only asked about whether it should be mandatory or voluntary, but also if it was voluntary, if it would be something that was free to the public or if they had to pay for it. So just as an idea, there's a lot of different kind of side choices going on, and we need to find values for each of those side choices for all of those different control measures. So if we slide back over to the code, this is just setting up the data frame with all of these different choices and essentially expanding it. So each row in the data frame is each of those different possible sets of choices, those 44,000 different things. And then we go through and we allocate different budget amounts for each of these things being removed. And then we also set the parameter values. So for each of the rows, essentially it's going to set these values. So it's going to say, for example, in the data frame, the first value for the iota for this particular row is going to be either 6.2 to the -10 if they choose no travel ban, 2.9 to the -11 if they choose only country X, or it'll be 0 if they choose to ban all travel. And then you can see that goes through for each possible different policy choice that they make and really encapsulates all of those different possibilities. Okay, so now we have this branching narrative kind of in place in our heads. We have the model, we have the code to run the model for each of the different choices. The next thing is really turning that branching narrative into a game. So the way that I chose to do that was using Twine, which is this open source tool for telling interactive, choose your own adventure type stories. I kept a little bit under there just because I thought it was amusing in retrospect. It says you don't need to write any code to create a simple story, which I didn't necessarily find to be 100% true. But we can get into that when we move forward a little bit. But I do think it was a pretty intuitive one for not having a good amount of a background in things like JavaScript or HTML and those kind of coding languages. And then with Trine, you use that to build your story, and then you essentially can find different servers you can host your story on. So we just chose to use this itch.io, where you can essentially host your game for free, and people can go on and search and play your game on this server. So in Twine, essentially, this picture on the left is going to be the full layout of my entire story. So each of these squares is essentially a passage where you're telling people, okay, you need to make this choice. And then based off the choices they make, they go to the next boxes and kind of take you down this full narrative possible set of paths. And just as a zoom in of what that looks like, since obviously this is hard to read, for example, in this one, you have contact tracing based on which they choose. They can either go to no, app-based, or manual. And then they move forward to the next question, which is looking at lockdown and so on and so forth. And then within these, essentially what you do is you can click and open each passage. You can write out text that people will be reading. So for example, this is telling them they need to make a choice. And then it also has this kind of basic markdown language that it uses. So you can tell them, if they choose to instate the lockdown, I'm updating a budget variable within the story, and I'm taking them to close schools, which is the next passage that they'll go to. And then this is just using to show things like the budget. And then here, I just added this one as well to show kind of some of the extra code that you need to use in certain situations that I wasn't necessarily expecting to need to learn how to do, where you need to set different variables, use things like if-then statements using their specific language, which they have multiples actually. So this one is called Sugar Cube, but for the most part, it was about as intuitive as you can get for learning a new system. So then the next thing within building this in Twine is really to work on the game aesthetics, particularly, like I mentioned, visualizing the effect of each choice on disease spread for the public that's playing the game. And originally the plan was just to export a graph for each of those different choices and pull it in to show up. But unfortunately, the server, the itch.io place that we were going to host it, has a cap on the number of files you can upload with the game. So that wasn't actually a way to do it. So we had to pivot a bit. And instead, essentially what has to happen is we run the model for each of those possible choices of set of choices in R. We export all of the daily values of those different compartments, so the SEIR compartments, and then we have to import all of those daily values into Twine using JavaScript and figure out how to do the graphing within Twine. So just as an idea of what that looks like code-wise, this is just running the model for all the choices. So for each of the I rows within there, we're running the SIR model that we defined above, and using all of the different U values and new values that were defined up above as well, and getting an output where the name of each of the possible outputs is kind of the list of all the choices. And then we have to export that at each of the different time points using a JSON file. And then within that, we come over, this is the Twine interface, and essentially this is the story JavaScript where you have to pull in each of the different files using the story JavaScript in order to use them. And then the next thing was the best option that I found in order to graph within this kind of Twine server is this chart.js, which we use to do the case count graphs, which is, here's an example of kind of what that looks like graphically. Essentially, a nice graph that shows you different colors over time and can show you your choice versus different people's choices. And then just quickly in the code, again, this is kind of one of those things where, you know, you technically didn't need a lot of code in order to make Twine work, but in the long run ended up needing a lot more than I thought. So ended up having to use JavaScript, which is what this is saying. It's just saying we're now entering JavaScript coding, which I then had to teach myself. But essentially defining the variables given whatever set of choices people have made up until that point, and then doing the graphical output lines for each of those different choices as well, and kind of doing some of the different display things so that it actually ends up looking nice. And then the next thing, game aesthetic wise, is using HTML and JavaScript for the overall aesthetics. And the reason that that's necessary is because this is an example of what the game looks like if you export it with absolutely no aesthetics added. So not necessarily the most appealing game for the average lay public to want to play, just a black background with white text. So in order to kind of update it to be a little bit more appealing, I used a template provided online. This is kind of the base template that I started with, and then went in and changed some things within that and ended up getting something that looks like this. So you can see a little bit more appealing in the overall, and then just quickly the code on that, another case of kind of things that you need to do in Twine that are more coding heavy than I realized they would be. So within Twine, you have a story style sheet that's written in HTML, which I also had to teach myself. And within that, it kind of defines a lot of those different aesthetics, the majority of which I was luckily able to copy and paste from the template, but things like the colors and different things on the sidebar, I had to go in and make some changes on. So yeah, we end up with this nice aesthetically pleasing output. And just a quick couple of things to point out that I think are nifty bits about the aesthetics. I included state breadcrumbs in kind of a different way. So essentially what I did is I created this logo for the Outbreak simulation using just the online free kind of icon dictionaries, and used a different logo for each of the different policy choices that are in order. So as you're going through the game, the logo for the choice you're making is next to the title page. So for example, here we have the contact tracing logo. And as people go along, then they can kind of look back and say, okay, I'm at contact tracing. That means I already got asked about travel bans and I already got asked about awareness campaigns. And just kind of keep in their head, because there are so many choices, all the different things that they've done thus far and kind of what they have to come. And then another thing is just that there's a link to the team webpage, which I think was a nice feature, where when people click on the author title, then it will take them to the PIP pilot webpage and kind of give them more awareness about what hopefully, if we get the phase 2 grant, will be kind of becoming this preparedness center, and give them more information on that as well. And then also a nice feature is just the stats bar. So if you click on that, you end up pulling up the stats bar for the budget, so you know where you're at in that regard. And then also for public awareness. So in this case, public awareness starts at about average, about 50%, and it can go down or up based on those PSAs that you get asked about. So it can go down to lower awareness, or it can come up so people are more aware and more willing to comply with choices. And this little side thing just lets people double check values without it being on the page at all times, which was nice. So now that that's all aesthetically pleasing and built out, the next thing is looking at kind of the in-game choices and the end-game survey. So at the end of the game, participants are given the option to click a link and go to an external survey in Qualtrics. And by clicking this link, it anonymously records their in-game choices using query string. So the query string, essentially, I save the variable throughout the game in Twine and then add it to the end of the survey website so that it saves all of those choices when they click. And then it also has these survey questions that focus on things like the demographic information, the number of times they've played the game, whether certain experiences with COVID-19 affected their decisions, and whether they agree with different sociological beliefs like we touched on before, things like the greater good versus personal interest. And then, like I mentioned, the data can be used to do some analysis on the choices that people tend to make, whether it's different by subgroup, and some of those different health beliefs that are underlying different policy choices. So just as kind of a summary before we get into the game the demo of the game, the Outbreak simulation game prospectively impact, we really think it can help with decision-making at both the lay public and the policymaker levels. At the lay public level, it can help to educate the public on the efficacy of these different control measures. It can increase the understanding of all the different factors that actually influence the policy decisions. So accounting for things like the budget, the public awareness, what the current disease levels are at, things like that. It can also increase the trust of the policies being put into place during disease crises, like pandemics, and all of these things, like I discussed in the background, will hopefully help lead to increased compliance and intervention uptake by the general public. And then at the policymaker level, it can also assist with helping policymakers really understand some of the different possible effects that their choices might have on disease prevalence, both immediately and eventually, because they don't necessarily have the background to understand how these different things might affect the disease prevalence over time. So future steps, this is very much still an in-progress game. So right now I'm still in the works of creating the post-game survey and trying to decide which sociological beliefs to ask people about, things like that health beliefs model. One of the other main things that I really want to focus on is creating a more detailed end game page that really focuses on educating game players on the impact of their choices, as well as the comparative impact of making no policy choices or the best choices, and some of the general takeaways, because I think a lot of times if you make these choices and you end up feeling like it doesn't have an impact, it can be a little disheartening. And that's not what we want the takeaway to be. We want there to really be some education and some increase in kind of the trust of those policies and the efficacy of them. So I'd love to get feedback as well on some of the most accessible graphs to use in the end stage to really optimize the takeaways, because I think there's so many different ways you can graphically show the output of disease simulation models, and some of them can be very specific to people in the field. And I want to make sure that it's something that if the general public is looking at it, it actually resonates with them. And then one of the other big things that I'd like to add in is the effect of an app-based awareness campaign. So for the PSAs, they tend to kind of have the effect you would assume within the game, where right after the PSA is put into effect, you have the biggest impact on compliance. So people are most aware or least aware, and kind of really affects their compliance. And then as time goes by, because they're not seeing it again, it kind of goes back down to the average and returns to the mean value. Whereas if you had something like an app where people were, told what the case counts in their area or in their country were, then it's continually giving them that awareness over time that just keeps that up throughout the course of the epidemic. And that could have a very different effect versus just a PSA. So that's something that I'd like to figure out how to add into the game. And then one of maybe the easier things that ended up not being quite as easy as I hoped is I'd also just like to figure out how to create share buttons so that the game can be easily disseminated, or for the low-hanging fruit jokes so that the game is easier to go viral. So those are kind of just quick things that looking forward, I'd love to work on and get thoughts on. And then before we get to the game demo, I just wanted to do a quick acknowledgement section. So I'm part of the Majumdar Lab. My PI is Maya, who's on the call. So I wanted to thank her for all of her help, as well as the lab members for all of their kind of feedback on the aesthetics and the way that the game plays. The pilot project, particularly Dr. Brooke Foucault-Wells, who was the sociologist within the project, who really helped kind of understand some of those different underlying sociological beliefs and is helping me with building that survey at the end. I'm a member of the computational health informatics program between Boston Children's and Harvard Med. And then, as I mentioned right now, funding for the project is coming from the AI-SDM team. So obviously want to thank you guys, as well as for letting me talk to you today and kind of explain the project and get feedback. So on to the game demo. Let me make this big screen. Okay. And I'm hoping that this can be something that is at least partially interactive, because it is choose your own adventure. So if you guys in the room want to yell out some of your choices, or if people on Zoom want to say choices when we get to each of the different policy decisions, please feel free. And I'm just going to kind of quickly go through and read the text on the screen. So don't worry about trying to read it as I'm talking. So essentially, the beginning bit telling you that for the past month, cases of an unknown infectious disease have been recorded with increased frequency in some country X. Disease detectives believe that the causative agent is a respiratory pathogen, but they don't know a lot about it otherwise. And you are a government official in country Y, which is about 1,500 miles away. And it's really up to you to determine the decisions that your country is making to protect its citizens from the disease spread. Each choice is going to have a financial cost, so you have to make sure you spend your country's budget wisely. And you can see it depleting in the tracking bar on screen. And then when you're making these choices, you also have to consider public compliance and the possible effect on case count. So the first thing is travel ban. You can see it says it's been 5 weeks since the outbreak was declared in country X. In the last week, total cases have almost tripled. Thus far, there are only about 260 cases outside of country X. And as you can see, your country has only reported a couple cases thus far. So just an orientation to the graph, because we'll keep seeing this kind of graph layout. The bottom is just going to be weeks since the outbreak was declared in country X, and the y-axis will be number of cumulative cases. And then the text goes on to say there is frequent air travel between country X and your country, so you can choose to implement a travel ban that will be in place for 1 month. You can either implement the ban on all international travel, only travel from country X, or you can allow travel to continue as normal. So it's up to you guys. What do you think we should do? Anyone have thoughts? Go ahead.
I vote for continuous travel.
You said continuing, no travel bans?
Yes.
Okay. So you chose not to enact the 4-week travel ban. It's been 1 week since it's ended. Below, you can see the impact on the number of total infections in your country. And you can see essentially the black line is pre-travel ban, and then post-travel ban, the red line is going to be your choice, so no travel ban. And the 2 gray lines will be the other 2 choices, and you can use the tooltip to look at which one is which. But moving forward, we're also still working kind of on the aesthetic of that, where the graph, hopefully the different grayed out choices will figure out how to make them different shades of the color. That way you don't have to necessarily use the tooltip. So that is on the list of future steps as well. Okay, so some time has passed. Researchers have confirmed we're dealing with a respiratory virus of a known type, but the strain is novel, so there's no vaccine readily available. Cases are continuing to rise in country X. There are now multiple cases in other countries, many of which have frequent travel to country Y. You can create a PSA that increases the dissemination of information on the disease spread in your country. And if you do, you get to decide the message being provided, directly affecting the public's level of concern and their morale. So you can either decide to downplay the disease's threat to increase public morale, or you can make it clear to the public that the disease could be an issue in order to increase awareness and safety measures. So what do you choose to do? Have a PSA that downplays, keeps the public alert, or skip awareness altogether? So we have one who said downplay. Okay, so now you can see the public awareness bar shows up, and public awareness that started kind of in the middle is now way down here. So given the continued increase in cases, you can choose to implement some kind of contact tracing. At the very least, your advisors urge you to tell all citizens that they should self-isolate when they test positive, but you can also require citizens to download a smartphone-based contact tracing app that lets them know when they're in contact with infectious individuals, or you can fund the training of teams to perform manual contact tracing, which is to say calling infected individuals' contacts to alert them of exposure and ask them to get tested. Do you choose to enact contact tracing efforts?
Yes.
How about app-based?
Okay. So you choose to enact app-based contact tracing. Further, your choice to create a PSA downplaying the disease led to a lower uptake of self-isolation behavior and contact tracing. Below, you can see the impact on the total number of cases. So in black, you're going to see pre-travel ban. Red is post-travel ban. And then all of a sudden up here in the dotted lines, it's going to be post-contact tracing. Red will be your choice. So you can see it did have an effect. And then the gray will be the other possible. So no contact tracing would cause cases to go up significantly further. And manual contact tracing might have cut cases a little bit, but it would have also been more budget-wise.
So does it keep track of like, I mean, I know in the background, it's keeping track of each step
Yeah.
you've made. Oh, and you can cycle back and forth, it looks like.
Yeah, I'm gonna take that out when people are playing just because it makes it, then you won't be able to record the in-game choices, but I've kept it for now, just A, to help me in the development process, but B, kind of for helping to show as well.
But the text there, it's telling you, like at this step, it's saying, because we created
Yes.
the, say, downplaying the disease, that has an effect on are potential right now, right?
Yeah, so within fine, I use just a basic kind of if-then statement where if they chose for the PSA choice, if they chose downplay, then this text shows up. If you choose awareness, then text shows up telling you that it increased compliance. And if you didn't choose anything, then the text just won't show up at all, essentially. Okay. So the next thing will be lockdown. You can choose to instate some degree of social distancing order to stop the disease from spreading. You can choose to instate the full lockdown for 14 days or not. If you don't, you're still able to choose to close schools and or non-essential businesses for a month. Do you choose to instate a lockdown? Yes or no? Someone said, of course, no lockdowns. Okay. So you choose not to. Would you like to close schools to help curb the spread of the epidemic? Yes or no to closing schools?
Well, if we're not locking down, we can't close schools, so.
Okay. And then would you choose?
Maybe to clarify, Norm, you can close schools even if there is no lockdown, which is what a lot of did.
I was just saying, if we're gonna be consistent, yeah.
Oh, I see. Okay, so to be philosophically consistent, I see. No problem.
I didn't mean to derail things, yeah.
Okay, so we didn't close schools. Do we want to close non-essential businesses?
Wait, what? It's,
So Kathryn, it looks like there's a question in the chat. I don't know if you have the chat up.
Yeah, just a second.
Yeah, Kathryn, you can answer this now if you want, or we can have like a longer discussion once you're finished through the walkthrough, your choice.
Yeah, let me finish the walkthrough and then we can talk about it because I think this is one that'll be a little bit of a discussion. But I appreciate the question and I will definitely get back to it. Okay. So closing businesses, yes or no?
no.
I didn't catch that one. Did we say no to that one too?
We're gonna vote for no here.
Yeah, we're
Okay.
not for,
Okay, so now you can see you chose to keep schools and non-essential businesses open for the month. Below you can see the impact. So obviously that has a pretty intense impact on number of cases that we chose not to do any of those things. And then if you use the tooltip, you can kind of look at some of the other effects. So this is only business closures versus this is school closures. So you can see schools would have had a lot more of an effect than businesses. And then the ones down here are going to be schools and businesses, and then lockdown with different, either keeping it open or keeping it closed.
So I guess that goes against what I said, so if we had closed one or the other, it would have made it much bigger difference, it looks like, right?
Exactly. Yes.
Yeah, schools would have been the kind of one of the big ones to close that would have helped out, which I think these are things that when I'm moving forward future steps, I definitely want to work on figuring out how best to kind of highlight that with the education prong to point out to the public kind of, obviously doing full lockdown would have the most effect, but closing just schools would have a pretty big effect, or even just businesses versus keeping everything open, and things kind of similar to that to be pointed out over time as well.
Yeah, I think a big part of the messaging here is the fact that you don't need to do everything perfectly to have a pretty significant effect on how the outbreak progresses, but you do need to be decisive about the choices that you're making. And you might need to make choices that not everyone will be happy with, but will certainly be more effective than making the choice that is maybe most restrictive, like the lockdowns.
Yes, for sure. Okay, and then just as a quick kind of note, because we are going to skip one, since we chose not to close anything, it automatically skips the mandatory testing passage because that's looking at testing when people are returning to either schools or businesses after closures. So since we didn't do that, it'll automatically skip to the at-home test distribution. And then just as I'm mentioning that, a quick reminder to notice the state breadcrumbs. So this is, a very hastily made icon of a rapid test being taken to a house. And you can see that's over here. So you can see all of the other different choices you've already made and then how many choices you have left to go. So that might affect kind of your budgeting as well. Okay, so voluntary testing at home is limited by the cost and availability of test kits. This can affect whether symptomatic people go into public, and it can impact the voluntary reporting of cases. In order to increase voluntary testing, you can arrange for tests to be delivered to residents' doorsteps. You can either provide them to all residents or to just low-income residents. What do you choose to do?
I'll test to all residents because we have lots of budget left.
Okay. Okay, so you choose to provide at-home testing kits for all residents. And then further, your choice to create a PSA downplaying the disease led to a somewhat lower likelihood of individuals using the tests and continuing to choose to self-isolate. Below, you can see the impact. So you can see you do have a lower case count when you do choose to deliver them to all residents. Low income is pretty similar. And then up in this gray bar will be, I can get the tooltip, will be no distribution of tests. So then mask mandates. In order to curb the spread of disease, you can require masking mandates at all times, at large gatherings, or not at all. While some portion of the population is already masking voluntarily, a government mandate could help increase the proportion, thereby decreasing disease spread. And you notice kind of before we get this question answered that the public awareness, which was way down here, is starting to come back to normal now that it's been farther out from that PSA and people are kind of forgetting some of the messaging from that as well. So what do you choose to do? Require masks at all times, large gatherings only, or do not require masks? Okay. Sorry.
At large gatherings.
Okay. And then to increase the effectiveness of masking policies, you can offer free delivery of high quality N95 masks to people's doorsteps. You can also choose not to do this and require people to buy their own masks. What do you choose to do?
Provide.
Okay. So this is one that I think is really important to highlight when I'm getting into focusing on some of the educational parts to add in. As you can see, your choice is here in red is large gatherings and masks provided. The other choice that really cuts down cases is always wearing masks and providing masks. So providing those N95 masks is really the thing that cuts down cases pretty intensely because they are very good at stopping the spread compared to people wearing just kind of any mask that they have. Obviously, that doesn't account for the fact that people can choose not to wear them or can wear them incorrectly in this case, but it has a very large effect versus the other choices up here where you chose to let people either not wear masks or to provide their own. And then essentially the text just says, yeah, you chose to provide people with high quality respirators, which increased intervention effectiveness as more people were able to follow mandates with good quality masks. Okay, so 2 more questions left. A short while has passed and cases are rising quickly. You can implement 2 weeks of universal paid sick leave to encourage folks to stay home when they're sick and thus reduce transmission. Do you choose to fund paid sick leave, yes or no?
Yes.
Okay. So you can see you chose here is the impact below. So in black is pre-mask mandates, red is going to be post-mask mandates, and then the dotted lines, red is your choice for sick leave and gray is if you chose not to. So you can see it does cut down on the case counts. And then final choice is vaccine mandate. So some time has passed. A vaccine is now available with 90% efficacy. You can choose to make it mandatory or voluntary. If it's mandatory, it has to be free to the public. If it's voluntary, you can choose whether to make it free or for the public to have to pay. And then it mentions, don't forget to consider the costs of procuring the necessary stockpiles and hiring the workers to provide vaccinations. So what do you choose about the vaccine? Do you make it mandatory, free, or paid voluntary?
Paid voluntary.
Okay. So you can see some time has passed. Below you see the impact. This was your last policy decision. Click continue to see how it went in your country. So having people pay for the voluntary will be the one that causes the lowest vaccination rates, so the highest case amounts. And then voluntary free is kind of in the middle. And if we chose a mandatory vaccine, then you would cut down on cases quite a bit. So then we continue to the end game page, which, like I mentioned, this one is very much still in progress, but it says see below how your country fared. And this is just doing kind of the classic SIR graph that you see with infectious disease. So essentially, to orient you, the red line is going to be susceptible number of people. So it starts out way up here and eventually goes down over time. Pink is the number of people who are currently in the infected class. So you can see kind of where it peaks there. Blue is going to be the number of people who have died, which is obviously low, but is still, for our case, about 2.4 million people. Orange is going to be recovered. So that's people who got infected and then ended up recovering. So you can see that is about 214 million people who got infected and recovered over time. And then the green teal is going to be vaccinated. So obviously that starts going up once the vaccine becomes available and doesn't go too high since we didn't make the vaccine mandatory. And then the last part of this page is getting into some of that comparison. So it says, don't think your choices made any difference. Let's compare your set of choices versus if you chose not to enact any policy changes and versus the best possible policy choices. So the first graph is just going to be showing kind of this pink line from up above, the infected people per day. So pink will be your choices. The two gray dotted lines will be no policy and best policy choices. So you can see if you didn't make any policy choices, it would peak considerably earlier and higher. And then the best policy choices is significantly lower, where way down here, it's about 18.5 thousand cases per day instead of about 20 million cases per day. And then this is just the graph that we've gotten used to seeing throughout all of the choices. So you can see your choices in red for the total number of cases. You end up with about 216 million. If you chose not to enact any policies, it would be about 288 million. And if you chose kind of the best possible set of choices, then it would only be around 380,000. And that's essentially just listed below. So it says, as you can see above, your set of choices caused the epidemic to peak 90 days later compared to having no policies in place. With 90 greater infected, that is not the right value I meant to put in. I need to fix that. So with, about 10, 15 million greater infected individuals per day at the peak, and then further, you ended up having 5 less. That is also not the correct value. I just fixed this right before and I put the wrong things in. That is my bad. But you ended up having about 50 million less total cases than were if you were to have no policies enacted. And I am making a note to fix those values once we're done here. Okay, and then the last thing, there'll be text above the survey button that kind of has the IRB required compliance text that if you click, your choices are being saved and, XYZ, but then you can click to go to the survey. And that will automatically save all of their choices into the survey for us. And then they can go through and do the different demographic and health policy related questions. And then to switch back, that is the end of the presentation. Obviously, we're going to discuss questions and suggestions, but if you have any others that you'd like to reach out, this is obviously still a project in development. So I'd love to have everyone's different thoughts as well. So please feel free to reach out to me over either of the emails, and we can go to questions at this point.
Kathryn, it looks like there are a number of questions in the chat, so why don't we
Yeah.
start there?
Okay, let's see. Is public happiness shown as a result of actions or just number of infected, budget, and public awareness? I believe you mentioned public fatigue or something similar as being one possible result of the actions. So right now, public happiness or like morale is not one of the things that's currently affecting the outcome of compliance. That was one that was really tricky for us to kind of figure out how to implement well, especially kind of trying to figure out a definition of morale that it was able to be implemented. So that's something that I think in the future, we definitely would be interested in maybe figuring out some way to account for it, because it definitely will have effects. But thus far, it does not. The main things are going to be your budget, your general awareness of the public, and then the case counts.
Yeah, and to maybe kind of elaborate on what Kathryn said, part of the reason that we ended up excluding morale as one of the indicators is because we talked with our social scientist collaborator, Brooke Wells, and she really kind of gave us a lot of perspective on why this is such a tricky concept to capture, especially in this sort of game design, because this is an area that she has a lot of expertise in. And one of the things that she explained was that morale can have, you know, a push-pull effect where you can have a decision that has positive outcomes on some people's morale and then very negative outcomes on other people's morale. And that's really difficult to capture, especially if you're not really restricting your understanding of this game into a specific population that has a specific set of values. So that's one of the problems, right? Like, depending on whether the country that you're operating in is the United States versus the UK versus India versus China versus South Korea is going to have vastly different impacts in terms of how people perceive the way that these decisions affect their morale. So not only is there heterogeneity in a given population, there's heterogeneity across these populations. And because we're not being specific about which country we're making these decisions for, and that's on purpose, we thought that it might be better to leave it out for now, but it's definitely on our radar. Morale is definitely on our radar.
Yes, for sure. Are there plans to extend the model to show death information rather than just total number of cases? Yeah, I think that would definitely be something that would be good to point out to people, particularly just as well because the graph at the end, it seems very small until you kind of hover over it and realize that it's multiple millions of people. So I think that's something that would definitely be helpful to show maybe throughout as well as just cases.
Yeah, I think that's a good idea, Kathryn. Maybe make a note of that. It would be good to
Mhm.
add. That's one thing to mention to folks that are on the line. Obviously, this depends a lot on how deadly the disease is, right? So we're crafting kind of this pseudo fake disease that feels similar enough to diseases that people are aware of, you know, like flu and COVID-19, but it does vary a lot. Right now, if we were to kind of revamp the compartmental model that underlies this and make it more akin to, say, tuberculosis, the outcomes would be very different. And that's also on purpose, right? We've opted to show folks how to make choices in a situation that they're more familiar with, because flu happens every year and now COVID's happening in terms of epidemics every year. So that's part of why.
Mhm. And then having the cost displayed before making the choice, which I think all of them should have that. I'll have to double check if there was a choice that didn't have that. But yeah, I try and make the cost shown on each of the pages that you're making a choice. And then also it's always available in the stats bar as well that I mentioned. But I will double check that that's the case. For
It
sure.
looks like Tyler has a question. His hand is
Yeah.
raised, and that was his
Go ahead,
question.
Tyler.
Hi, thanks. Thank you for the presentation. I was wondering if one of the ideas is basically to look at how people are making public policy decisions in this context. Is it possible that someone, like I'm imagining someone who might be, say, a conspiracy theorist who doesn't believe in masking at all, for example, but in the in when they're going through the game, they're maybe deciding, well, I'm just going to say that we should do masking because I want to win the game or like get, you know, the fewest number of people sick or something, because there's that sort of gamification element to this. So is that a concern? Is there any way you could see if that type of thing is happening? And if there's any interest in that? Thanks.
Yeah, I think that's definitely something that it will be interesting to see kind of based on some of the survey results. Hoping that people do submit their choices and go to the survey, that it could be, we could ask questions about not only if COVID affected your choices, but if during COVID you followed mask mandates the majority of the time or something like that, where we can really see, are the policies that you chose to enact actually the ones that you were willing to follow during more recent epidemic, and kind of seeing, yeah, if it is one of those things where people are just making choices for the game, or if they're making choices they really believe in, and how that kind of susses out. Because we're very, I think, curious to see what some of the output of the survey results versus the in-game choices could be, just because it is something that hasn't necessarily been done a lot before, and we don't necessarily have a lot of a precedent for, what to expect on it.
Yeah, and maybe to just follow up on that, I think, Tyler, what you're mentioning in terms of gamification and how that can affect the way that people play a game. There are a couple of interesting features to the way that this game is that I think are interesting. So one thing that makes, people's choices or beliefs around masks or vaccines interesting is that our understanding from folks who are conspiracy theorists, right? So folks who don't believe in masks, who don't believe in vaccines, is they don't believe in them because they really don't think that they work. So it's an interesting kind of, dichotomy here. It'll be interesting to see whether that's what they personally believe, but they believe that in the game it will work, so they make that choice or not, right? So I think that there's a lot of complexity here, even around conspiracies around different health information and health behaviors that, we are super aware of and really trying to capture with the survey, as Kathryn mentioned. And this is part of why we're working with social scientists so closely, because I think that there are a number of issues here that are really difficult to parse out. And there's this idea, even kind of in conspiracy theory land, especially in the health information space, that people have certain beliefs for themselves, but those beliefs don't apply to other people, and vice versa. And I think that that's partially what Kathryn's getting at. We want to get a sense of, are the decisions people made in the game the same decisions that they made for themselves, right? So I think that there's, I think a lot of potential for some unearthing some interesting findings here. Are we going to be able to, assert causality? No. But I think what we can do is exactly what Kathryn mentioned. This is the first time, to our knowledge, that something like this is being done, especially in the context of a pandemic simulation game. So we want to see whether or not we can make some interesting conclusions about the types of people that even play this game, right? The types of people that play this game repeatedly to get the best outcome. So that's another issue here as well that we're really interested in, and we're working on figuring out how we can make sure that the game will kind of collect every single gameplay that somebody does. And so those are the sorts of things that we're kind of grappling with right now, while we're still in the, very much the pre gameplay time space of this project, right? So we're not expecting this to go live for another several months, and that's part of why opportunities like this are great, so we can get feedback from other people.
Yeah.
It looks like Robin has a question in the chat.
So the different choices follow what different countries did and the end result of a set of choices. So the policy choices, the values for the effect of each individual choice is based on a lot of research that I was able to dig up from the majority from the COVID pandemic, kind of across different countries, and a lot of analyses looking at relatively which choices had the biggest effect, if there was any data on specifically what that effect was in terms of reduction in transmission or R naught, and those different things. And then the travel case importation rate was based on travel rates between different countries in the world as well. So I tried to make it as helpful based on real world data of effects of the different policies that we saw. Certain policies were tricky to be able to find data on, but for the most part, I was able to find some amount of data on the effect of all of these different policies from other countries in the world.
Yeah, we've got a question here in the room too.
Yeah.
Hi, thank you, Kathryn, for the chat. This is Verity from the COSO Learning Group, and I have a question for you, which is, have you considered about also checking the player about like the place where their population density is? So for example, like if you're living in a like very dense population cities, for example, New York City, versus like if you're in the countryside of Australia, then apparently it will be different, right? And like maybe your choice will also be impacted, and the consequence can be quite different as well.
Yeah, that's a really interesting point, and I think that's something that would be great to be able to pull out from that socio-demographic survey to figure out a way to ask that correctly to kind of get an idea of where people are, or at least what type of environment they're living in, because that very likely will affect their thoughts on different things that they saw based on, you know, living through the COVID pandemic with all of that different policy being in place in the countryside versus a big city. So that's a really good point. Thank you for bringing that up.
Yeah.
Forget New York.
Oh, Norm, are you trying to say something?
Sorry.
Go ahead.
I was just gonna say, forget New York City versus rural Australia. I mean, you could notice a difference going from East Pittsburgh to the North Hills, right? Where I live.
Yeah, definitely. And this kind of gets at the heterogeneity issue that I raised earlier, and part of why we ended up kind of excluding morale from the game for now. I think that every single decision is in fact influenced by the heterogeneity in a population and across populations. So that's part of why we're posing a fictitious disease in a fictitious country, right? But what the reality is still that the way that people play this game will be heavily influenced by their own personal belief systems based off of where they live and the experiences that they've had. And so that's what the survey aims to kind of get at. And it's really impossible to be able to accommodate like every type of environment, right? In the gameplay setting. And that's part of why we decided, let's just, you know, talk about a very random country that we're not giving too much information on to help the gameplay kind of proceed in as unbiased of a way as possible from our perspective, but there's still going to be biases from the game player's perspective. And so that's hopefully what the survey results will at least help us start to get at just a little bit. You know, we know that we're not going to get at everything, and we're very aware of these issues. Like the heterogeneity inside of the population matters a lot, and we do expect gameplay to be very influenced by where people are from. But yeah, that's a great comment and a great, just, you know, I think it's just a great acknowledgement of how difficult these sorts of problems are to grapple with. So we're trying our best to kind of keep the game as unbiased as possible, so we can start to tease out what are the biases that game players are bringing into playing the game. Kathryn, Tyler had an additional question.
Yeah, I was gonna go, I can click and show you real quick what happens when you run out of money. Let's see. Okay, let me go through and make expensive choices really fast. All travel, country ban, create a PSA, manual contact tracing, lockdown, stay closed. Repeated weekly testing. Okay, so essentially we ran out of money, and at the bottom it says you've used all your allotted budget. Click to see how the epidemic ends for your country, and you can see we're only at the end of mandatory testing right now. So if you click continue, then it takes you to the end stage immediately at the end of that particular choice. So you can run out of money, and it will kind of immediately end, and then essentially we'll have some sort of text at the end that says, you know, if you're not happy with how it went, feel free to try again and make different choices. But yes, you can run out of money. And there are a good amount of choices.
One interesting thing here is that it looks like in this particular set of choices, you do worse than no policy choices at all.
Yeah, yeah.
So I think that that's something that we should definitely, you know, when we write all of this up, we're going to kind of explain why that's the case, right? So making bad policy choices can sometimes be worse than making none at all.
Which it did push the peak back, which there is, you know, viability to that. But yeah, it does end up being higher and having higher cases. Yeah.
Right. And I think that it's worth discussing. Sometimes pushing the timeline back allows you to develop new technologies that then, reduce fatality later on, for example, like vaccines.
Okay. Any other questions, comments, concerns?
I think we got to everything in the chat.
Awesome. Thank you, everybody, for taking the time and all of the questions and comments. And like I said, if you have anything else, please do feel free to reach out to me. It's still very much in the development phase, so I'm willing and able to hear any constructive criticism at this point.